The National Education, Health and Allied Workers Union has raised concerns about the high number of unclaimed bodies as state mortuaries. The union is worried about the toll this has taken on its members. Now, let's get more details on this from our reporter, Nobuhle Modise, who joins me now live from Durban. Nobuhle, what has instigated this particular matter and where are we now in this regard?
A very good morning, Ms. Chaba. So just for some context, you'd remember that about 3 years ago, the Forensic Pathology Services in Durban Central and Umbilo, to be precise, in Gale Street, was where most of, the dead bodies in and around the province would be transported to. But then that shut down around 3 years ago. And ever since then, that has put a strain on the surviving, Forensic Pathology Services in and around the Durban. So what had happened there is that they're saying they were shut down due to compliance. Now with this, this particular morgue where I am at in Pinetown is inundated with a lot of bodies. The one in Phoenix, rather, as well as one that's close to Port Shepstone. So because of the closure of this particular Forensic Pathology Services in Gale Street, this has now been the problem. Now, NEHAWU has been sounding alarm bells around the working conditions here, particularly for their workers. If we're standing right outside here, but the stench here is unbearable. The smell is putrid. Ms. Chaba, as we are standing here, and that's because the bodies are piling up and they haven't been collected. You'd remember last week that the Health Minister, Dr. Joe Phaahla, had a report around the number of unclaimed bodies in South Africa, and the ones in KZN were at the top of the list. I have with me the Provincial Secretary of NEHAWU, Ayanda Zulu, just to speak to us about what their particular concerns are with regards to this situation. Thank you very much, Mr. Zulu. Speak to us about particularly what's concerning you around your workers that are based at these Forensic Pathology Services.
Thank you very much. Almost 2 years ago, as the National Education, Health and Allied Workers Union in KwaZulu-Natal, we did what is called the effect-finding mission, which meant that we visited all the mortuaries in the province of KwaZulu-Natal, but with a primary focus in 2 cities, which is Durban and Pietermaritzburg. We visited Phoenix, we visited Pinetown, we visited Parkrin, and we also visited the one that is in Pietermaritzburg, Fort Napier. Our conclusion was that there is a massive overcrowding that is in these mortuaries, which put a lot of strain to our members. You remember that the health system in our country and in the province is severely understaffed. When we started to have engagement with the Department of Health, and also the report from our members was that there's quite a lot of unclaimed bodies. Some date back as from the floods, some date back as from July unrest. But we must make a point that we got a report in some of the mortuaries that after the work that we have done as the union, the department started working together with SAPS to safely bury those bodies. You know that there are some, in terms of the National Health Act, there are regulations that regulate that at least within 30 days, if the body have not been claimed, and that particular body must be the responsibility of the state to bury. So we are also pleased as NEHAWU that almost at last the Department of Health have come out in the form of the minister that the system is under a lot of strain. As we have early indicated, we have made a call as NEHAWU in KZN to say the Department of Health need to open another Gale Street. By another Gale Street, we mean that the community of Umbilo, the community of Chesterville and surroundings must have a mortuary that is going to service because Gale Street used to service that part of the community, and it was among those mortuaries that are bigger. So without having Gale Street, there's a lot of influx going to Phoenix, which makes the capacity of Phoenix, they said, is between 500 to 600 bodies. That is why at some time we went there, and there were some there were bodies that didn't have even the space where they can be put at.
All right, now, Ayanda, let's speak about the conditions in terms of your workers. I mean, I haven't been inside here, but just standing outside here, we can all smell, what it's like. As someone who's been inside here, what are the conditions exactly, and what is it that your workers, the workers that are affiliated with NEHAWU, are particularly complaining about?
Yeah, the conditions are extremely bad. As I've indicated, if you have got bodies that have not been claimed, that dates back as from July unrest and floods, you must know that the conditions are extremely bad. The smell is unpleasant. On many occasions, as leaders of the union, we have entered these mortuaries, and I can tell you, when you get out of these mortuaries, your life is never the same. That is why we have made a call as NEHAWU, working together with the Department of Health in the province, to say workers must be provided with psychosocial support because of the conditions. And you know that most of the unclaimed bodies in general are precisely because of people who die largely on an unnatural death, because that is where, and some of them, some have even suspected that they are not from South Africa. That is why it is extremely difficult for them to be claimed. But the conditions are bad. That is why we are making an appeal to the Department of Health that under no conditions there must be a shortage of the PPEs for workers. And the issue of psychosocial support must not be something that we must even make a call, or it's something that daily workers must be provided with, because the conditions here, they are extremely bad. And you can hear the smell as we are standing a bit far. And you know that there are some reports that we always get on some technical faults from the fridges. I think that they have got an impact. Sometimes some bodies here, they will come after quite a number of even months. That is why already when they are here, they contribute in terms of having the smell. So workers here is one of those jobs that is almost like a calling and a service to our community. That is why we have always said workers here deserve to be compensated. You know that if you are here, workers they are almost general workers. They drive these cars. Sometimes these cars are even hijacked. I think you heard the story last 2 weeks that there were workers that were hijacked. They do everything.
Thank you very much. That is Ayanda Zulu, the Provincial Secretary of NEHAWU in the province, just painting a picture for us on what exactly is going on inside or behind these walls. And like I mentioned, the smell here is putrid. We will be giving the Provincial Health Department a right of reply. But just to mention that a lot of people have been driving in as we've been standing here, obviously to come and identify their loved ones. And I can only imagine that this is re-traumatic, as the experience of losing a loved one is already traumatizing, and having to walk in here and walk out and smell the stench here, as I said, is quite putrid. I can only imagine that it's just re-traumatizing for those who have to come here and identify the bodies of their loved ones. But we will be giving the health department a right of reply with regards to these issues and where they are in terms of providing another forensic pathology services in the Durban city centre, or in the Durban CBD rather, that will be able to take in the influx of people that are having to come here and in Phoenix.
All right, thank you so much for that.